Hi, Dr. Peter Montgomery, family practice doctor, here to talk again about the COVID crisis. Okay, today's issue is I'm sick. What do I do? I'm going to go over some advice to do what to do if you think you have COVID or if you have the flu or just general taking care of yourself or a loved one when they're sick. And again, we're going to be talking about the 5 W's on the back end of the show, and we're keep talking about what we can do to stop spreading the COVID virus. Thank you.
Now, when you are sick, and every year I have over 4,000 patients, active patients, and every year or so I will lose a patient to influenza. And the story is always the same. The family who goes, "Oh, he or she just lied there for a week. Oh, he was so achy and sore. He was too sick to come to the doctor." I don't ever want to hear that one again. Too sick to come to the doctor. Really? Because you can get him up and move him. He won't move. There's 911. If someone is too sick to go to the doctor, you call 911. This nurse saves lives. I know she's a villain in a movie, and her attitude on her face, she's a wonderful actress. Uh, Mean nurses save lives. Move your butt, get up, get going. You won't get going, I'm going to get help. That is what saves lives. The nice nurse goes, "You just sit there, let me bring things to you." Patients have a bad habit when people are sick going into the patient role. "Oh, I'll sit here and not bug people. I'll just sit here and ring the bell or ask for something for comfort." Yes, we do recommend bed rest, but we don't need to stay in bed 24/7. You need to get up and moving. Mean nurse will get you going. People who take less pain pills and are practically forced to walk are the people who leave the hospital the quickest after surgeries or after any disease. You've got to get up and move. Obviously, the benefits of walking. Um, the main thing here is we're talking about blood flow. Blood flow, all your immune system's in the blood flow. It needs to get moving there. You need to get it going around. You need to get the blood flowing out of the legs and the calves and up to the lungs and the heart and keep everything going here. Circulation is everything. You got to force the lungs to breathe deep. If you're just sitting around, you breathe shallow, water starts to build up in the little air pockets, and then eventually you develop pneumonia. So forcing yourself to breathe deep. A lot of people are in lockdown. A lot of people are in a situation where they can't get out. Do squats, do push-ups, do sit-ups. If you have a flight of stairs, up and down the flight of stairs a couple times, and then go back to bed rest and recover. But we got to keep your energy levels up. You're trapped in your house. You're in bed rest. You're self-quarantined because you're COVID positive and you don't want to spread it. You need to blow off some steam. You need to keep yourself well hydrated. Keep yourself going here. The fluids, you are breathing faster, you're running a fever, you are slowly simmering and sauteing on the stove here, and you need to keep adding water to this system. Water makes everything work in the body. It helps with the blood flow. It is the universal solvent. It makes everything work. Keep yourself hydrated. Keep yourself urinating. You're not urinating, you're not well. So get up off the couch in the bed every hour or two, putter around, as I like to say, get some blood flow, get some breathe deeping, grab a glass of water, go to the bathroom, go back to bed. That's a healthy cycle. Now, obviously getting worse, short of breath, contact your doctor, call 911. If you're really having trouble breathing, you're probably going to be needing oxygen at that point. What can we do to prevent it? Lots of things to doing. I've been really pushing zinc. The reason the chloroquine and hydroxychloroquine work is because they help force zinc into your cells where they can gum up the works of the virus enzymes, and so they can't replicate, and also keep your infected cells from rupturing, releasing more virus, and triggering the cytokine release. Um, some very good research has been done on it. Zinc, it's not a question of if. Does it help? Of course it helps. It's clearly proven to help. The question is when, and that answer is as soon as possible. And again, family practice, we're all about prevention. I think everybody should be on a zinc tablet now. I've told my entire family, get yourself on a zinc tablet now. A multivitamin has some zinc. I've seen them have as little as 5 to 15 milligrams of zinc. Your average zinc tablet supplement will be 50 milligrams of zinc. chelated or not chelated? I don't know the answer on that one. Get some zinc, let your body chelate it itself. You can do that. Get it inside you. What is it doing? It is doing many things, but basically people get better quicker and they're less likely to get sick in the first place. It has been proven to prevent. They did a study on those snotty-nosed kids at elementary school who are always getting things. They put them on a nice tiny 10 milligram zinc dose and followed them, and these kids got less sick. Very effective. All the other things that can be done to help. Clear evidence that vitamin D can help prevent disease and help you get better quicker. Why do colds and flus go away in the summer? Not magic, it's sunlight. The sunlight triggers our body to turn vitamin D2, which we've eaten, into vitamin D3, which does many good things to our system, helps prevent infection, and seems to encourage our immune system to fight better. You can get vitamin D3 as a supplement, and I've also strongly recommended all my patients and family members to start taking a vitamin D supplement. I had a family member get in a situation where he can get some seriously good sunlight for a couple of weeks. Him and his wife are in a good situation with some natural vitamin D. It is very, very hard to overdose on vitamin D. So although that is possible, I do not recommend any crazy doses. 1,000 units to 2,000 units a day should be sufficient for what we need. If you are sick, suddenly taking 50,000 units every day is not proven to be helpful and could over time cause problems. Vitamin C, yes, we know now a long time that it helps, and echinacea has some assistance, but I put most of my money on vitamin D and zinc. Vitamin C, let's eat some fruits and vegetables. Let's get it from nice natural sources. And echinacea is similar to ragweed. It's in the same family and might trigger allergy symptoms in some people, but it has been shown to be efficacious. So these are the recommendations. Here's the article you can read in detail for those who want to break it down. But the thing is, the science is in. This works. It prevents colds and viral infections and shortens the duration of them. I strongly recommend everybody to do that.
All right, I hope that was some helpful information. Now to review. You're never too sick to get help, okay? If you're really sick, can't move, can't function, that's when you really need help. If your loved one is really sick, don't let them play the sick role. Be the mean nurse, make them get up and move. You gotta move, you gotta drink fluid, you gotta breathe deep, you gotta have the blood flowing. Things you can do to help yourself to stay healthy: drink plenty of fluids. To prevent illness, take zinc and vitamin D, absolutely proven to help. Vitamin C, I recommend you get it from food, from the fresh fruits and vegetables. And echinacea, if you feel you need an extra little bit of help. These are things that are scientifically proven to help you not get sick, and the best things you can do when you are sick. And again, we got the 5 W's here, and I'd like to remind them for you here with the little song I wrote. We're washing and waving and wiping and whoa, don't touch this washing and waving and wiping and whoa, don't touch this washing and waving and wiping and whoa, don't touch this washing and waving and wiping and whoa, don't touch this. We are all doing this. Thank you. Hang in there, everybody.